Hello, everyone. Thank you for joining us today. My name is Hudson Harris. I will be your moderator today and hopefully speaking as little as possible. I have the pleasure and honor of introducing three absolutely incredible women who are truly breaking the rules and changing things, not only in their careers, but for the lives of other people. What I'd like to do to start off is to have each of you introduce yourself, talk about your role, and then we will get in a little bit more about what you do today. So, Christine?
Great. Hello, everyone. I'm Christine Moutier, and I serve as the Chief Medical Officer at the American Foundation for Suicide Prevention. I'm a psychiatrist by training, and before I was at AFSP, I had an academic medical career at University of California, San Diego, where for the 10 years before I joined AFSP, 5 years ago, I served as Dean for Student Affairs and Medical Education. So I was doing lots of advising, teaching, mentoring, and the usual clinical practice and research. And so it was actually through an experience of physician and medical student struggles and loss to suicide that I became more and more focused on suicide prevention solely.
And I am Dr. April Foreman, so I'm a licensed psychologist. I'm also technically, I know it's a party killer, so I'm a suicidologist. You have the same problem, I bet. And I'm here as the chief clinical outreach specialist for technology and innovation for the Veterans Crisis Line, which is too many words. But I got here in a very weird way. I had planned a very different path for my life and just became convinced that we weren't adequately helping people in severe and lethal emotional pain and that we could do something different, and now have sort of a one-of-its-kind job in terms of applying technology and innovation to the problem of suicide.
Hi, I'm Lori Miranda, and I'm one of the founders and head of content for Wellbody, and our mission is to inspire and support people to live healthier, happier, and more meaningful lives. And we recently launched our app, the Wellbody app, and it's designed to help people take a mindful approach to their health and wellness using short guided audio sessions. If you're familiar with any of the meditation apps out there like Headspace or Calm, ours is a similar idea, except we focus on health and wellness and on making short, simple changes in your daily life that promote well-being. And so we take a holistic approach, focusing on 5 areas of health and wellness: nutrition, exercise and movement, sleep, stress management, and connection, because those are the largest contributors to how healthy and well we are and our overall quality of life. In terms of my personal background, I have my Master of Science in Social Work from the University of Texas here in Austin, and I'm a certified health and wellness coach and a certified nutrition consultant. And more of my social work background was spent in a policy planning and research role. I most recently worked for Travis County Health and Human Services, where I helped them research community conditions to really understand the needs and then help create processes and plans to help meet those needs and strategically plan on how to invest in social services, as well as working with community groups to collaboratively problem solve some of our community's issues.
So in the interest of full disclosure, I am a Wellbody app user. It's absolutely wonderful, so please do check it out. It really is an approach that works. So given that today is International Women's Day, what I'd like to kind of start as a starting place for this discussion would be for each of you to talk about something in your past that was where you started to break the rules. Each of you has pushed the boundaries in your own way. You've each changed and saved lives. But if you could pick something that was either a tipping point for you or something that really stands out as a way that you've started to make your mark, if you could share that. Chris?
Sure. This is great, and I'm excited to hear from you two as well about this. I bet we all have amazing and funny stories to share. Well, there was one moment when I was probably about 5 years into my faculty career at UCSD. By then, I had already become Assistant Dean for Student Affairs, Medical Education. I had started the work of mental health, wellness promotion, and really trying to destigmatize help seeking for physicians and other healthcare professionals and trainees. And that was, on the one hand, welcomed by the school as a very necessary next step in its sort of progression and evolution as a modern place that acknowledges that healthcare professionals are human beings with mental health needs as well. But it came to a head in one particular conversation when we had, my mentor, Sxsw, and I had been charged with getting to the bottom of the multiple suicides that were occurring among our physician colleagues. Meaning, find out how many have happened, what's the deal with it, does the culture and the environment have anything to do with individuals' risk, and is there anything that could be done about it in a medical school and workspace learning and working environment? And so on the one hand, it was an official charge. On the other hand, some ideas that we had as we took some time to develop the program and what the strategy was going to look like were, you know, if you've ever had to do this, where you're kind of swimming upstream in the culture of an institution, and you're having to explore and sort of, in a way, innovate and try to apply science to implementation. It's a very creative and very challenging process, actually. But there was one particular conversation with someone who was sort of my boss's boss, when I had some ideas about suicide prevention programming, and she just wouldn't hear of it anymore. It was like, I think her ambivalence about drawing attention to ourselves as an institution, as a place that has problems or struggles in any way, shape, or form, there was always that ambivalence. So there was a moment where she screamed at me, "Just stop this. We will not be known as the suicide school." And so it was sort of this moment of, okay, and maybe this is part of the deal. Like maybe you getting screamed at or having haters in the space. Maybe sometimes that is a part of change. But of course, it's uncomfortable in the moment. But yeah. So anyway, that was an interesting moment.
Thank you for sharing that. April?
So I did a terrible thing. I moved back home for family reasons. I am from rural Kansas, and I'd finished my PhD, and I was getting a career in academia. And instead of doing that, I went to live in rural Kansas. And there was only one job to get. It was community mental health, not the place that you want to start if you want to go anywhere, right? In a town of 8,000 people for, I think, $31,000 a year, like food stamp wages with my family, right? Totally did a thing. And so I started practicing in this town. And I noticed really quickly that we had clients with intense emotional pain, multiple suicide attempts, not doing well. And here's the dirty secret, lean in, that I found out. You guys are amazing audience. And what I found out was that we could just let them be very, very sick and in a lot of pain and just bill for a lot of contact with them. And we could just have one or two patients. We could bill so much for them, they could be 10% of our revenue. Think about that. We were making a lot of money off of them doing really, really well, so really badly. So you can imagine how popular it was when I brought that up at every staff meeting. Like, not that, just like, why aren't we doing better? And then you can imagine how much they loved me. So I became very depressed. I've never not been loved at my work. I'm an overachiever. And so I got very, very depressed, and I hired a coach for a huge portion of my income at that time. And she said, you know what you should do? You should go on social media. And this was in about 2008, where clinicians did not do that. And she said, what do you need to do? And I said, well, this group of patients needs dialectical behavior therapy, but you have to meet Marsha Linehan. She's super famous. And you have to start a DBT clinic. That takes $30,000 just for the training. They won't pay for this. I can't get them to pay for like 1 hour of continuing education credit. And she said, no, you're just going to use Twitter, and you're going to meet Marsha Linehan, and you're going to open a DBT clinic, and you're going to come up with new things to do. And I said, but it's wrong to go online if you're a clinician, which was really the attitude a decade ago. And she's like, nah, just do it. So I did it. That's a big story, and I did it, and it was nerve-wracking, and it still is for many mental health professionals. And I eventually also get a website. I do a project with Johns Hopkins and Health Central. I was doing all this weird little stuff. I do meet Marsha Linehan, by the way, and get a DBT clinic. That totally happened. But the real rule-breaking moment for me, and it was so funny, and I was waiting for it to happen that I animated it like I found like little CGI of my boss sort of talking to me in a crazy way, and then I would show it at all these presentations later. Jan Cosgrove, wherever you are, I owe you. So the clinic director knocks on my door, and she's like, "Dr. Foreman, can I come in?" Like, it's really serious. She's like, "We need to have a seat." I'm like, "All right." She says, "Dr. Foreman, it's come to our attention that you've been engaging in online activities." Like I was a cam girl. And I said, "Jan, I'm so glad that you noticed. You found my blog." Blogging was like not a thing that clinicians could do. Like, all of you cool people were doing it since you were born, but not me. And I had to learn how to do all this stuff, right? And I had written some posts about borderline personality disorder and how clinicians and how clinics mistreat them, and like how you change that or how you make that better. I never referenced my clinic, it's wonderful. You can still find it. It's like 7 signs of borderline burnout or whatever. It was great. I think it was a great piece of writing. And she sat down, and I had prepared for this, and I said, "Jan, let's talk about this." And she said, "If you go online and talk about the problems with our clinic, the patients will know we make jokes about them," which, by the way, they do. You should know that. And I said, "Jan, they already know." And whereas I was probably about fixing to get terminated, they decided, in fact, that they would support me in doing that and all of these other projects that I did, working to do text messaging with high-risk folks, tracking their mood, working to get a DBT clinic and all the things, and then eventually it goes into other jobs. But I think it was just preparing for that moment when the establishment was going to say, "You've done this thing we're not sure about," that got me through.
That's great. Okay, so for me, it's not necessarily like one particular tipping point, but kind of where I started and then where we are today is more of a series of several different barriers that I'll start talking about when I worked for Health and Human Services. And so just working for local governments, there are a lot of barriers when you're trying to make change. That's just the nature of working in a bureaucratic environment. And it makes sense because we have to be stewards of public dollars and be responsible. So you can't innovate in the way that you might want to. And so in and of itself, that was a challenging environment for me to continually come up against barriers. In particular, I had one project that I had been working on for about 2 years that was really near and dear to my heart, and they pulled the plug on it in the 11th hour for reasons not related to the work that I had done. So that was extremely frustrating and really highlighted for me that there were going to be these barriers within that environment that I just could never get past. And so thinking about that also combines with the fact that my husband has a business background and has worked in the tech startup world for the past decade, where it is all about innovation and trying things and moving quickly. And they would have an idea on Monday, and by Friday they were implementing some aspect of that. And that was really foreign to me and also really exciting. And so I started thinking, okay, what could we do if we put our backgrounds and our ideas and our experience together? Especially, we both had an interest in health and wellness and really on simplifying what it means to be healthy, because I think so much of our society overcomplicates what it takes to take care of ourselves and promote our own well-being. So we started talking about what that would look like if we combined our efforts. And so we decided to create Wellbody. Now, another barrier I want to highlight is this idea that we unintentionally create barriers around ourselves based on our job, our career path, our educational backgrounds. You know, I have a social work background. I'm not supposed to do business. I'm not supposed to do something in tech. And it was interesting to me when I left that job, some of the reactions I got from people I'd worked with in the community, it was if I was doing something totally different and abandoning the cause. And that was interesting to me because I didn't see it that way. I felt like I was taking my expertise and background and applying it in a new and different way and combining it with my husband's experience. Similarly, he experienced the same thing to a different extent, having a business background and going into health and wellness. You can imagine how that was taken. And so it's interesting to me the barriers that we unintentionally create around ourselves based on, our degree or our job title or the families we come from. And so that's another barrier I want to talk about. And then the actual Wellbody app came out of some barriers that we had noticed within our company. So when I left my previous job, we had actually started doing more of a one-on-one health coaching practice. And so there's a lot of research on the positive outcomes of working with a health coach on health outcomes, and we saw that firsthand with all of the clients that we worked with. However, we noticed two things when we did this. The first was that no matter who came to us, no matter what their goals were, or a 55-year-old male who has high cholesterol and was trying to lose weight, or a 35-year-old female who was not sleeping well and really struggling with stress management. It didn't matter what they came to us with. We were having the same conversations with every client. Because at the end of the day, most of us know what we need to do, the changes we need to make, but we have our own personal barriers to making those change. So whether it's things within our life that are, responsibilities, jobs, family, or our mindset about what we can and can't do. And so really working with clients to overcome those, we saw some consistent themes and underlying principles. That, coupled with the fact that we had unintentionally created barriers around who could access our services, because working with a health coach takes time, usually an hour each week during the work week when people have work, and it takes money. It's not cheap, so you have to have some disposable income. And that was something we did not want to do. We wanted to make this more accessible. So we thought about how we could take this idea that we had these consistent themes and want to make it more accessible to people, and that's how we came up with the app, was a way to take that information and make it more accessible to people.
I really like this idea around the barriers that we create for ourselves, because I think a lot of times, not to be glib, but that's a big part of mental health, is that we build up our own walls, our own impediments to our success. So, April, do you have some thoughts on maybe barriers that you've created for yourself that you've had to overcome, or things that...
Oh, sure. So my people they're all like farmers and mechanics. I was the first person to go to college, let alone get a PhD. And the hardest barrier, which you would think would be leaving home and going away, was actually this whole Marshall Linehan thing. That was in 2008. The thing that I felt was just that I wasn't important enough. And Lynn would tell me, you're just go meet the most famous people who know the answer to the thing you want to do. And I was like, I'm nobody. She's like, find a way to meet them. If you care about this, why wouldn't you? And just ask them for advice. And I was terrified to do that. And Marshall Linehan is wonderful if you're looking her up online, but she's a mean hugger. She's an intense lady. And within the year, I was with her and Kelly Kerner and Linda DeMeth and a bunch of other people. And it was like a thing that I did. And the picture of me doing that, by the way, is a picture of me like this with Marshall Linehan with her arms around me. Terrified. And I think it was the idea of, no, just find out who's doing this brilliant thing that is important to your mission, and then just call them, tweet them. I tweeted her. That's what happened.
Yeah, I completely agree with that approach. That was actually one of the first ways I met Christine, was just reached out and started to talk. Christine, do you have some thoughts on barriers and things that you've created for yourself over the years?
Oh my goodness, there's so many different layers to that, really, honestly. I mean, part of my own journey to being full-time, forever dedicated to suicide prevention, it started with my own crisis when I was in medical school. And I had been one of those young people who was raised, I'm half Chinese, so you're in that perform, your value is linked to your achievement 100%. And that's all fine and good as long as you're doing that thing and achieving and always top of the top. And so what happened for me was this blessing in disguise of a horrendous crisis that you wouldn't wish on your worst enemy, but which is transformational and changes everything forevermore. And so then, you're grateful, but you just go, oh my gosh, is there any other way to get there? So, your question, it just reminded me of this moment where in the first time I got therapy was that year, and I took a year off med school, thought I was done with it forever, because I, believe it or not, had kind of a PTSD-like experience from all the things going on in the first couple years. And in the therapy, I wasn't, I thought I was going to med school for primary care or pediatrics, so I knew nothing about psych. So this was like, I'm untrained, and I'm in the therapy going, what's happening here? We're sitting here. Donna Salk is in a rocking chair. We're like just chatting about my early childhood. This is not helping me. And yet what was happening was this experience of identifying your constructs that are very invisible to you. So I had some beliefs about myself that, as I mentioned, were linked to your value is only present if you are doing X, Y, or Z. And oftentimes we don't realize that. We don't have the opportunity to even uncover it until you're living outside that realm. So I'll just say that the beauty of mindfulness and CBT and DBT is that you have this opportunity to discover the rules that you've been playing by that you wouldn't apply to anyone else on the planet, and yet somehow you lock yourself up in that construct. And if you can find a way to work through that, it is just incredibly freeing.
So speaking of freeing, Laura, you recently took a huge leap of starting Wellbody and really going all the way, with everything. You and your husband launched it, and it's, as I said, I really enjoy it. But what were the things that you did to prepare for that? Like, how did you mentally steel yourself? What are the things that you needed to do to check your own box to take that big leap?
Well, that's a good question. So for one, I definitely think I'd hit a point in my job where I wanted to do something different, but I didn't know what. And my husband and I had been kind of throwing this idea around and building it out. It actually had been more of his idea, and I was just helping him with it. And then the more and more that I helped him with it, the more I liked it. And I actually had gotten pretty far along in a job interview with Dell Medical School, actually. And I got to a point where I thought I was going to get it. And I realized then that I couldn't work on this other thing with him. And so I realized that I needed to just try this out, that there would be other jobs out there if this didn't work, but I needed to just try it. And then, there's been a lot of stuff where we've had to figure out how to make that work because we're married and we have 2 children and we play a lot of roles together. And so that's been an interesting process, but I think it's been great. And I think it's really easy to, honestly, starting your own company is like having another child. The highs are really high and the lows are really low, and it changes from week to week, from day to day, and honestly within the day. The morning is different from the night. And so I think just trying to ignore the noise, because it's very easy to get caught up in that, of what other people are doing, or should we be doing this? And so my mantra is just focus, focus, focus. What am I supposed to be doing? Focus, focus, focus. And then I actually had a professor once say to me, in terms of running, constant forward motion, no matter what, just keep going forward. And I think about that a lot with this, is just, even if I am like limping along, I'm going to keep on going. And so.
April, I've known you now for quite some time, and you're a lot of times a catalyst for change at the organizations you work with. You're, building SPSM, the work you've done with AAS, the Veterans Crisis Line. Is there something, at your time with the Veterans Crisis Line or something similar where you can, share some about what it was like to understand the challenge you were about to face, at least conceptually, but then how you also built yourself up to try and jump that hurdle to make it over?
So if you are lucky, you have a brain where you can see where the future is going to be or what needs to be done. You can see what the aspiration or the goal is and a possible way forward. But does anyone know the myth of Cassandra? Like, she knows that Troy's about ready to fall, and she's trying to tell everyone because she can see the future, and they kill her for it. So if you're the lady who shows up, I don't know, it was a good sum up, wasn't it?
Interesting moral of this story.
All right. So if you show up and you're like, guys, like, this is what's going to happen, I promise you, everyone's going to get really, really anxious. The system is the way it is for a reason, and if you're going to do a badass thing, you're going to disturb equilibrium. This is really intimidating. And Tony Wood, who's the board chair of the American Association of Suicidology, and he was my very first collaborator back in 2008, I remember what he said. He goes, well, but aren't you an expert in emotions? Fair. He said, if people are going to get anxious or they're going to get resistant or they're going to get really, really upset, aren't you literally a PhD with a clinical license in fixing that? You should just manage their emotions, because in many cases, it is not the great idea that is the catalyst for change. People have great ideas all the time. Walk outside, ask people for their great ideas. You'll end up with 100 business cards and a few drinks. It'll be a great day. The thing that gets it done is finding a way to connect with and collaborate with and reduce the anxiety with the people who do want what you want, but are just, they can't see what you can see. And so you just simply say, I think that a future is possible. Don't we want more than this? And find what you agree on. I see that you'll be anxious. That's only reasonable, you say. Here are the ways we could manage that. And you just keep going forward and be as kind to anxious people who are afraid of change as you possibly can. I learned that the hard way because I don't think I started patient. But because they really do care about your mission. You just get them on your side.
So, Christine, physician wellness is something that's near and dear to my heart, also to several of my friends, and we recently went through some efforts on trying to build that. And I think your experience of being yelled at is not something that is necessarily unique. Sadly, it's something that I know people who've experienced it, and so I just want to say thank you for pushing those boundaries, because those things are never easy to do. And it's the only way sometimes to make those changes. So I would ask the same question of you that I asked of Lori and April is, what's a recent challenge or something that you've really tried to tackle that you had to, gird yourself, maybe at AFSP or something to that effect that...
Sure. Well, the thing that actually comes to mind is still from my earlier time in academic medicine. And I mentioned sort of the early sort of crisis and transformation that happened. Well, one thing that has stayed with me forever and continues also at my work at AFSP is that what was happening there in that work to develop a culture around safety and having real conversations with stress, depression, addiction, and if you're at risk for suicide, was... If you've ever worked in a place or lived in a place where you wouldn't even breathe a word of your own human experience because it just would not fit. It's somehow you're not supposed to be a human being like that. Academic medicine can be, or was, I think it has been changing a lot. But one thing that I took with me is that almost this feeling of being at ease with the possibility that you are going to get kind of thrown out for being too radical. Now, part of this also is that my style tends not to be abrupt. I actually am much more of let's work as a team, and I'm willing to see this through. Most things that matter are a long process. It's a marathon, not a sprint. But I think this mentality that is a little bit weird, I don't know if I should even recommend it, but where you almost feel like, you know what, I love what I'm doing here, but I'm doing it for this reason. So if they're not ready for that, I'm ready to go over here. It's a little bit of probably a self-protective mechanism that it's okay, and you're not entirely defined by X, Y, or Z. And what that allowed me to do was to actually take more risks, even though I did have that sort of long view. And one of my strategies also literally was just out survive people who are, and if if you can live and wait that long enough, and like you said, just keep on moving
Keep limping forward.
Yes. But that risk-taking approach for someone like myself who is probably not hardwired normally to be a risk taker has been a very exciting way to actually do that in a way that that someone like me can do. It is a lot of risk taking, but it's gentle, and it's just there's a sense of calmness and confidence about it.
That's wonderful. April, I would ask you, we've got a little bit of time left. So what I'd like to do is ask each of you, starting with April, where do you see this field, where you are and what you're doing, in 5 years? I think we can all agree that there's about to be an exponential amount of growth in mental health and what's going to happen. So what are your predictions for the next 5 years if we're back here in 5 years?
So I'd like for there to be more people doing technology and innovation in the mental health space. That's my wish. One of the projects that I'm working on is how to get a data enclave with all of our crisis data, for example. So in mental health, I would like for us to start collecting data and start doing real attention to hard-nosed outcomes. I don't want for us to continue to, like, if I spend 50 minutes with you, I get paid whether it worked for you or not. I don't think that we should keep doing that. So I think data, outcomes, I would love for us to, in the next 5 years, start having data about people's mental health experiences, not just in the clinic, but in general, in the hands of excellent scientists. We have not moved the science forward at the pace of the scale of the suffering. So that's what I'm hoping to do, is speed that up.
So Laura, if you can share the 5-year plan, or whichever, what's your big audacious goal for Wellbody? Where do you see it in 5 years, and how is it going to get there?
Well, I would love everybody to be using it. I guess it speaks to Wellbody, but also just in general. I really think that there is more attraction around this idea about mindfulness and being intentional in the choices that we make. And so I think 5 years from now, I hope that everybody knows Wellbody and is using it. I hope that there are other apps out there that are doing a similar thing, because, we need our Ubers and our Lyfts. We need to start building an industry around this, because at the end of the day, it is the choices that we make every single day in our lives that impacts how healthy and well we are, how good we feel in our daily lives, and just our overall quality of life. Hudson, when we spoke on the phone, you said that quote that I love: how we spend our days is, of course, how we spend our lives. And I think if we can be more mindful about the choices that we are intentionally making, are we scrolling on our phones, or are we being present with the people that we're with? Are we, having a couple drinks after work to unwind, or are we going outside and walking around in nature? Are we heating up a frozen meal and eating it in front of the TV, or are we cooking something even small and simple and sitting at the table with family and friends? And these aren't easy choices. And sometimes what you need is to sit in front of the TV or have that glass of wine, and that's okay. But it's a matter of being mindful about the choices that we make. And I think in 5 years, there's more traction around this. I think there's more traction around not just exercise and movement, but sleep, stress management, and connection. Those areas are gaining traction, and they are just as important as exercise and movement. And I also would personally like to see less focus on the right diet or the right way to eat, because that's constantly changing, and really getting back to just eating real food. I think we can all eat a number of different ways that suit us if we're just eating real food. So I'd like that to start taking front and center, and I'd love Wellbody to be part of making that happen. And of course, just everybody using us.
Thank you. Christine?
So we at AFSP have this suicide rate reduction goal that many organizations and agencies share, and that is a 20% reduction in our national rate of suicide by 2025. So that's almost in 5 years. So that is what I would really, of course, just we are striving for that in every way possible. And of course, this is a multi-pronged approach at so many levels. And the thing is, every individual and every industry has a role to play. If you're interested in learning more about what we think are the fastest and most evidence-based ways to get there, you can check it out at afsp.org. We have a webpage devoted to Project 2025.
Say it slower so they can type it.
afsp.org, Project 2025. But in addition to those very strategic business science-informed pathways, some things that you all were saying also 100% apply. Number one, the culture needs to change around the reality that everyone suffers at different times. And when you're in that place of suffering, it's really hard. It's just, even if you're the world's expert on this topic, somehow you become paralyzed and want to hide and withdraw. So the culture needs to understand that at every moment, that when you detect that little twinge of difference in somebody, it's very possible that they're in that moment. And so a tremendous outpouring of support and safety and outreach can happen so that they will disclose what they're going through, and people will talk about it if the setting is right and you're a safe person. And the second piece, that picking up on what you all are saying, is impact and measurement of that impact. You're so right. We shouldn't just keep doing things in the same status quo manner, but we need to know what produces the results that actually are helpful to people, that reduce risk. Some of that is going to involve big data and access to bigger data sets to understand which changes in, whether it's the healthcare system or in a workplace, are leading to changes in population, human behavior, and suicide risk.
Donate your social media data today at ourdatahelps.org. That's a project to get big data sets to, nobody makes any money, just get big data sets to scientists who can help us answer questions about suicide we didn't answer before.
Could you say that slower for those playing along at home?
Ourdatahelps.org. What Christina's talking about is that one of the big barriers is just getting large data sets into the hands of scientists without huge obstructions or delays. And so people who have died by suicide, they're survivors or someone who survived a suicide attempt. You can donate your social media data, and I can get that to a linguist, and one of the best in the world. There's several, and we've already done several studies out of it, that can do really good science. Because when Christine's organization or the Veterans Crisis Line, if we're doing any of these big things, like, they need to know things about suicide we just don't know yet.
So we just have a few minutes left, and so I always like to end these things with hope and inspiration. So if each of you could kind of share 2 or 3 takeaways about, what can people do to help them get there? So for the young women out there looking at what types of careers they could go into in mental health, for people struggling in their current jobs, but what are the things that we can look to that would help people elevate or escalate or make the jump? What are things that have worked for you?
For me, pay less attention to the things that you're afraid of, and shift that energy, that little program in your head. You're going to upgrade that software and have it constantly looking in the environment for opportunities. Instead of being afraid of what bad could happen, look for something you haven't seen before. Look for what good is possible. You're not getting, for the investment in your fear, you are probably not getting the outcomes that you want.
Lori?
That's a good question. I'd say focus on the things that you have control over in your life. Oftentimes we feel really out of control, whether it's sitting in traffic on our commute or, the state of the world. We have a lot more control over the things in our life, the decisions that we make every day. And so really paying attention to what those choices are and being intentional with them. And then you said something about fear, which made me think the best advice I ever got was from my husband, and it was never make a decision based on fear. And I think if you approach any decision with that mindset, you're more likely to make the right decision and maybe take a leap of faith if that's something that you want to do.
Great. Well, I've already mentioned that I've had my own struggles, that I've experienced the loss to suicide of colleagues and others. And so my own personal decision to start sharing my story of struggle and loss was one of the best decisions I made. And it was frankly scary. And of course, many people are making that same decision now and courageously speaking about that. So for you, that may look like something different, but the point is to take more of a risk in the way that you feel could have impact. I mean, be smart about it. Maybe go over it with a trusted person in advance, but that risk will very likely pay off in a whole different direction. And the last thing is, if you are swimming upstream in your environment, find a like-minded person, find a team, because we are just stronger and more emboldened together.
Thank you all for being here. I really appreciate it. I know some of you traveled very far and some of you are close, but you all made the time for this really important topic. So thank you very much for coming.